Good morning, everyone. It's Monday morning. Um, Hope everyone's having a good week so far. Um, Coronavirus cases in New Jersey are up over 13,000 now, close to 60,000 in New York, with almost 1,000 deaths there. Um, continues to progress. Um, Continues to progress across the country. But today, I'm going to want to discuss a video by Dr. David Price. Get to that in a minute. I did post that video, and I really think it's worth watching. It gives a lot of good information. It really talks about, how this virus is transmitted and what's important to do and what is not important to do. Um, so, um, Talk about that. Hope everyone has some plans for today, plans to be active, you know, get out in the fresh air. It's not very nice right now, but still important to get outside. Um, Taking my walk today about 9 o'clock. Probably a 25 to 30-minute walk in. So, well, let's guess I'll get into Dr. David Price's video. As I said, that's posted in our group. I shared it in some other groups. Good morning, Michelle. Just saying, check out our page for Dr. David Price's video. It gives a lot of good information, very impactful about, how you think about the disease and what's important to do and what's not important to do. So I would, urge you to take a look at that. But according to Dr. Price and Dr. Price, good morning, Jenna. Morning, Marcia. Just starting to talk about Dr. David Price's video. Dr. David Price, he's a critical care specialist at Weill Cornell Medical College in New York City, one of the places that's ground zero for the pandemic here in the U.S. Seeing a lot of COVID-19. They stopped almost all their other services, and they do things like transplants and things there. So it's a big deal when they're stopping everything. But so he has a good perspective. He's seeing the people who are critical care who need ventilators, and he's the guy who decides who needs ventilators. But so he has a unique perspective. He's helping people decide who's being admitted from the emergency room and that kind of thing. So, he says that almost all the transmission he is seeing comes from sustained contact with either someone who has the disease or is about to become symptomatic with the disease. So he defines sustained contact as being in contact with that person about 15 to 30 minutes. Whether it's a person or you go to a group, for example, Mardi Gras, and are in contact with possibly even numerous people who had the disease, and in sustained contact, but sustained contact without any protection, without wearing a mask. And the mask is not exactly for what you think it is. As I'll explain in a minute. Not wearing a mask and not cleaning your hands. If you don't clean your hands, you're going to get the disease. Howard, good morning. Howard, I'm just starting to discuss Dr. David Price's video where the point is that if you're, I was just saying that if you're in sustained contact with somebody, whether one person or a group of people, and you don't protect yourself by wearing a mask or cleaning your hands, that you will um, be much more likely to get infected. Um, and why it, what's the importance? Why the importance of your hands, keeping your hands away from your face? Um, because it is transmitted by droplets. What does that mean? So when we cough or sneeze, there are droplets that are put out with that, obviously, but then they fall to the ground, they fall onto surfaces, they fall onto us. And if we take those droplets with our hands and touch our face, touch our mouth, touch our nose, touch our eyes, um, that's how we transmit the virus. So, to break that viral transmission, number one, you have to be a hand Nazi, as he calls it. Every time you touch something that somebody else might have touched, or you're in contact with any kind of person who could be ill, um, then you want to wash your hands. Second point is about masks. Good morning, Nancy. The second point is about masks. Um, Masks are not so much to protect us from the droplets. The social distancing is more meant to do that. But what masks protect us from doing is taking those droplets with our hands and putting them on our face, on our mouth, nose, and eyes. So, N95s will certainly offer you that protection. For people who are not medical people, it's probably not necessary. Um, if you're a medical person and you're doing procedures on somebody's respiratory tract, you can aerosolize the virus, which means it hangs around in the air around you for a little bit and you could breathe that in. That's where it's important to have an N95 mask. If you are practicing social distancing, um, the N95 masks are not really necessary. Certainly, they'll give you the protection that you need, but they're not really necessary. Dr. Price said he has not seen any transmission so far that he can tell of people walking down the street in New York City getting it, or people having packages delivered and getting it from the package. He hasn't seen any of that. It's been people who have people who have um, again, that close contact with people. So yes, wearing gloves, Howard, is a good idea. You have to get rid of them afterwards. I think what I'm actually doing is taking the taking the packages, unpacking them outside, even bringing the stuff in, and then washing my hands or sanitizing my hands. And I think that is the precaution for most people. It's fine, fine if you wear gloves. You just have to make sure you don't touch your gloves to your face, and maybe having gloves on reminds us not to touch the gloves to our face. But um, washing hands for most people should be sufficient. Um, if you have somebody who is sick in your household, um, what you should try to do is um, isolate them in one room. If you can, isolate them to a bathroom where nobody else is using it, if you possibly can. Obviously, that's not always can happen. Try to have them take their meals by themselves. If that doesn't work, then that's the one time you want to put a mask on somebody who's actually symptomatic to prevent some of that droplet spread. I would urge you wearing your own mask and that kind of thing. Um, and you can wear gloves if you want, but again, the gloves are more meant to remind you not to touch your face. Um, if you got the virus if you have intact skin in your hands, you're not going to get the virus through there. Um, So you don't have to wear gloves. You can just keep your hands clean, especially if you're wearing a mask and you're reminding yourself not to touch your face. Um, he said that even at the hospital, if the healthcare workers are taking the proper precautions, he hasn't seen any transmission there. Um, so that's very encouraging. He said the virus is actually fairly fragile in the sense that it's easily broken down by disinfectants and soap. So doing that is important. Keeping surfaces clean. He said you don't really have to go to the extent of using bleach and that kind of thing, but certainly if it makes you feel more comfortable, do that. Um, and um, so his four main points are um, that number one, become a hand Nazi. Anytime you touch anything that anybody else has touched, or you're coming in contact with a sick person, wash your hands or sanitize your hands. Number two, break that connection between your hands and your face. Um, Using a mask can help train us in that. Um, Number three, again, wearing that mask, but if you have N95 masks and you want to use them, that's fine. They may be in better use at our hospitals because that's where it's being aerosolized. And as somebody pointed out, usually when you have an N95 mask at the hospital, they're fitting you with the specific size. So I don't want people to get a false sense of security if it hasn't actually been fitted. Um, but wearing the mask so you don't touch your face. And the fourth point is, social distancing, maintaining that distance of 3 to 6 feet. Um, do, are there any questions about any of this? I think watching Dr. Price's video gives a lot of great information, different situations. His educational sessions about 30 minutes, and then it's about 30 minutes of questions and answers. And I urge you to share that with people. It helps to you know allay some of the anxiety about the way this is being transmitted, and how we can keep ourselves safe, and and even you know, practical tips on how to keep yourself safe when you have a sick family member in your household. So, um, yeah. Any questions? Has anybody watched the video yet? Anybody planning on watching the video today? Let me see what other points Dr. Price makes in the video. Oh, if you feel like you might be coming down with something, but you're not sure, you start to get a little cough. He recommends isolating for a couple of days. Usually, if you have coronavirus within 2 days of getting, you'll have fever within 2 days of getting those symptoms. Um, there is there is about an asymptomatic period of about 2 days. So if you come in contact with someone at that point, you should isolate, or even potentially come into contact. You should try to isolate. He said a lot of their transmission is happening when people are not isolating early enough, or coming out of isolation too quickly. Um, you know, or procedures are not being followed when people are sick. So, um, all right. Well, I don't see any questions this morning. Certainly, you can follow up with me, comments, post things to our group. Again, urge people to check out Jenna's immune support group if you haven't already, and follow all the great information that she's putting out there. And I will talk with you soon. Oh, did I miss? Oh, sorry. Missing the questions. I thought my screen would scroll down. Let's see. Morning, Elena. Um, um, Nancy has a question about beta blockers. Um, and let's see. So, Nancy, about beta blockers. Beta blockers haven't so much been implicated. Um, there is some theoretical um, concern about people with ACE inhibitors because the ACE inhibitors affect one of the receptors where COVID-19. Um, I think that that really isn't one of the main considerations. I think the main consideration is to keep yourself from getting it by using the precautions and the we haven't, at least I haven't seen any literature that says that if you're taking an ACE inhibitor for your hypertension, that you are any more likely to get sick or to get sicker, um, and end up on a ventilator. So I know that there are some theoretical concerns about that, but it hasn't, at least as far as I know, been borne out in what's actually happening. Hope that answers your question, Nancy. Cecilia, let's see. Going to watch it. What do you do about anxiety and going to the store? So, if you watch the video, I think you'll have a much better handle on that. He during the video specifically states that he has not seen any cases of people passing each other on the street or being at the grocery store and getting transmission that way. Um, because it needs to be some type of sustained contact with somebody who's ill, which about 15 to 30 minutes in an enclosed room. Grocery store, I don't think really fits that. But he does recommend when you go out to wear a mask, mostly so that you won't touch your mouth, um, nose, or eyes. Um, and it's only, it's transmitted by droplets, so it's not really transmitted by aerosol, which means it would be hanging around in the air. The aerosol is only happening in the hospitals. We're doing medical procedures on the respiratory tract and helping to aerosolize that virus then. When you cough, it doesn't aerosolize the virus really. It's more the droplets that can be spread about 3 feet, which is why maintaining social distancing of 3 feet via the World Health Organization, 6 feet by U.S. is recommending 6 feet, and that certainly is with an abundance of caution there. Um, so when I'm going to the grocery store, what I'm doing is I am wearing a mask and I am sanitizing my hands. I'm sanitizing the cart and just trying to, reasonably stay away from people for the most part. Um, but again, after seeing this, I feel much more comfortable going to the store that I'm not going to get infected that way. And then after I'm done with the store, sanitizing and you know, uh, you know, if you have some place to wash your hands, fine, or using sanitizer is fine also. So that's what I'm doing about the anxiety because it is not a major mode of transmission. It's, again, being with the sick family member, going to a group, probably going to a coronavirus party will put you at risk. People at risk. I'm not saying you would go. Um, you know, um, People who are still going to church services are probably going to be at risk. Anytime you're getting together with a group of people, that's where the biggest risk is. In a dense, closely packed group, um, being in a group, not really being in a group at the grocery store. I mean, you're there and there are other people there, but you're not in a closely packed group there. And as I said, if you're keeping yourself from touching your mouth, nose, or eyes, you don't transmit the virus to yourself. That's essentially how it's being transmitted. Droplets are falling on surfaces. You touch those surfaces, and then you touch your mouth, nose, or eyes, and that's how it's transmitted. If you break that mode of transmission, then you're not going to be infected. Um, I'm not sure if Dr. Price was on Fox News. I wouldn't be surprised. Um, that was a question again from Cecilia. Um, could have very well been Fox News New York City. I'm sure that people are picking that story up. Yeah, Howard, if you can search for him. Um, as I said, the link is on our Princeton Integrative Health Facebook page, so you can get the link there. Dr. Price's first name, Howard, is David. So Nancy, you watched the video. How did you like it? Did you feel like you got good information? Give Nancy a second to reply there. Um, just taking a look at my notes to see if there's anything else. Um, and I think we're all doing this. He says shrink your social circle. Be together with the people you need to be together with, but with everybody else, um, practice social distancing. Um, and this is from my son Justin, who is a graduate student in psychology. He said, while we are practicing social distancing, we should be also distance socializing to make those connections to make sure people don't feel too isolated. So I would recommend we all start practicing some more of that distance socializing. Um, and that can help ease people's burdens. I talked the other day about how some people are feeling isolated, some people are getting depressed. There's been a few reports of nurses committing suicide after they've been infected with the virus. We want to make sure that people feel supported. So if you know somebody um, who you are worried may be feeling isolated, I would recommend reaching out to them. Nancy, Nancy really liked the video. Um, gotten When I asked her if she liked it, we got an absolutely back, and she wrote down reassuring with 3 exclamation points. So that's what I found it also, that it's reassuring. It helps reduce anxiety. So please let's help this video go viral, um, pun intended, and help combat um, the fear and anxiety that go along with this pandemic. Good morning, Krista. Um, just telling everybody to watch Dr. David Price's video. I don't know if you've seen it yet, but it's certainly worth watching. Any other questions? I'll probably tomorrow also, I'll probably later today I'll make another post about Dr. Price's video and then touch base on it again tomorrow morning. So, because I think it's that important, that reassuring, that it's worth spending a couple of days on this. Okay. Um, no other questions. I'm going to say goodbye for now, and I will see you tomorrow morning.